So let's go over health advocates. So firstly, understanding the term. So health advocates. So these are simply anything that you can do to make sure that there is a good or a promotion of healthcare services in the community. So anything, it can be anything that is done to just make sure that there is a promotion. So the most important thing is the promotion of healthcare services in the community. So we are going to say that is health advocates. Now, it gets to include a lot of things. We're not talking about health advocacy. It includes a list of that you cannot even get to finish of a lot of the things, which include activities related to ensuring access. So activities related to ensuring access to care. So that is ensuring, let's hope we can say that, ensuring access to care. Of course, when we talk about care, in this case, we're talking about health care. Anything that you can do to make sure that there is going to be access to health care. That is health advocates. What can you do? Anything that you are saying about it. If you see that there's no proper access to health care, you come to speak out. You come to do anything possible just to make sure that there's proper access to care. Then that is health advocates. And also mobilizing resources. So if you feel there is need for maybe one hospital, maybe it lacks resources, it lacks money which they are going to use to buy medicines, or peradventure not just buying medicine, but they just lack resources to make sure that they maintain the hospital clean. So if you get to mobilize anything that you can do to make sure that there is at least money coming in, or resources, any resources to make sure that health service delivery is going to be good, anything that you do, that is health advocates. And also addressing, so just getting to address health inequities. So when you get to see that there are some things that are not right, there are some things that are just, they are just inequities, not really inequality but inequity. There is no equal distribution of maybe medicine, there is no equal distribution of things. Take for example, maybe there are health practitioners there, they just want their relatives to be receiving medicines because they are scarce, and when you get to take your relative there, there is no giving them medicine. So address health inequities. That addressing anything that you can do to make sure that there's something that is done. Of course, that is health advocates. Apart from that, also influencing health policy. So if you feel there is something that you can do to make sure that the health policy, the principles which get to govern the health sector are not really that nice. You want something to be able to be done, or something to make sure that it is operating. Maybe there is this policy that has been put, this is supposed to be done. You need to be going out to speak to people, sensitize people, but you think they are not doing that. So when you get to influence something to be done, that is advocating for health. That is health advocates. And also creating system change. Maybe you feel the system is not right. Maybe just general leadership of the health system, maybe something is not correct with that. So you want something to be done, something has to change in maybe the administrators or something like that. So when you create, or maybe just anyone who can create that system change, or anything that can be done to make sure that there is a system change, so that is going to make sure that what is we refer to as health advocates, and that makes sure that there is proper healthcare delivery. So this is very much important. So health advocacy has to do with a lot of things that we cannot even finish stating. Anything that you can you can do, or anything that can be done to make sure that a good health environment is promoted, that is health advocacy. Now let's look at some concepts when it comes to health advocacy. The first concept is social determinants of health. And the second, so this is the first concept in health advocacy, and the second one, health inequalities. Just not health inequalities, but health inequities. They might seem to be the same. So what are social determinants? So on the social determinants, here we need to understand that the conditions in which people live and work accounts very much to their health outcomes. So imagine people are working in a dirty environment. So the conditions in which you get to live and work really determines your health outcomes, whether you are going to be a health person or constantly sick. That is the health environment. So here we're talking about social has to do with the association with of people. So imagine you are living in a one roomed house, the 20 of you. Is that really healthy? No. And really you want to be healthy? Really not. So social determinants, very very important. Where you get to live, is it conducive? So that is one concept of health advocates. When you're advocating for health, make sure that the social determinants are also spoken about. People have to make sure that they have got a proper social environment where they get to work, where they get to live. It's a proper health environment. And when you talk about health inequities, these are simply some things which you think they are not being done in the right way or equally. Those are health inequities. So as you get to advocate for health, you need to make sure that you speak about those things which are unequal. An equal distribution of resources, an equal distribution of things. So health inequities mostly come because of, it can be economic reasons, social reasons, political reasons. So economic reasons, for example, if economic resources are scarce and you just get to give to only the rich. So these are health inequities. For example, medicine is scarce and the poor cannot manage paying for those things. So just get to give the rich who can manage. Those are also health inequities that have to be addressed. Social reasons, maybe because there are too many people and that is causing inequities. Those are just things which are not equal. So that has to be spoken about. So these are some of the concepts of health advocates. Now let's look at another thing, accountability in healthcare. So when we talk about accountability, this has to do with people being able to account for what they have done and being able to answer for the things that are under their control. So as you get to do anything, make sure that anything that is under your control, you are ready to answer for it. That is accountability. So there are important concepts that we need to know under accountability. One of these is loci, the other one domain, and then the other one is procedures. Okay, so these are some ways that we need to pay attention to. So when you're talking about accountability, simply the procedures and processes by which one party justifies and takes responsible for its activities. Any activity that you do, you need to justify it. You need to take responsibility, not just going to do things without being able to take responsibility. Imagine you are just getting to spend money for an organization anyhow. You need to take responsibility. Why are you spending money anyhow? What were you spending the money on? So that is taking responsibility, and also you need to make sure that you answer for it. All right. So as we get to talk about accountability in healthcare, you need to look at some things such as your professional competence. So competence has just to do with, are you able to work in an environment where a lot of people are doing it? professionally. And there's also legal and ethical conduct. So we also have financial performance. So apart from that, there's also adequate or adequacy of access. So this access is to medical care. And there's also public health promotion. So apart from that, also just community benefits. So and many more things when you're talking about accountability. Now let's talk about this. What does it mean? What are we talking about? So when we come to accountability, first we have got three components. So those are written on top: loci, domain, and procedures. Those are components of accountability. Now starting with loci. Loci is simply consisting of different parties that can be held accountable or hold others accountable. So just the parties. Who are the people who are present, who we can hold accountable or hold others accountable? So the parties that you get to look at, those, if something is not going in the right way, those people you are able to look to and say, why is this not going in the right way? Why is it that there's no proper medical delivery? Why is it that there is dirty water? So just those parties who can hold others accountable, or who you can hold accountable, that is what we refer to as loci in accountability, as a component. Now, when we come to the domains, domains are simply standards. So these are areas of accountability. They include now these things that I've put down here. These are the things that you need to look at as you get to judge if people are accountable or not. So these are some of the things you need to look at. Proper health promotion. Is it that health has been promoted properly? Are people having good access to clean water? Are people having access to medicine? Adequate access? Financial performance? Are people using their money for, for that is meant for community benefit properly in health terms? Are people working competently? So when it comes to competence, are people working with that zeal, that professionalism? So you need to look at those standards which are set for you to look at, to judge whether people are accountable or not. So when you get to look at these things, now you are going to be able to tell whether someone is going to be held accountable or not. So these are the things that you get to look at. Also, the community benefits of any action. Is the community benefiting from what is being done? So I need to look at that. Those are the standards you look at when you want to judge about accountability. Now, when you talk about procedures, these are just formal or informal for evaluating compliance with domains, or for disseminating the evaluation responses by evaluating parties. So procedures, formal or informal. So simply for evaluating compliance. Now, what do you use when you want to evaluate if people are complying to the domains? So, any formal or informal for evaluating, what do you use to evaluate? Apart from that, also for disseminating and evaluating the responses. So, what do you use to evaluate responses? Are people responding? Are people doing what they are supposed to do? Okay, so these are simply procedures. Anything, whether formal or informal, that is there to be used to evaluate if people are complying to all these domains. Are people following up? So you look at the procedures are what is going to determine. Now you look at, when you're talking about the procedures, formal or informal for evaluating. So you evaluate if the parties which are involved are making sure that the standards are followed, or the standards are given, if there is need for financial performance, so the parties have to make sure that they are held accountable. So these are the domains are there which are telling you what you're supposed to do. So who is supposed to do and who is supposed to make sure that the other one does, those are the parties. Now what we are going to use to evaluate whether this is doing what is right or not, these are now procedures. So if this one is doing what it's supposed to do, or they are not doing what they're supposed to do, so that those are now procedures. Now let's look at cooperation in healthcare. So when you're talking about cooperation in healthcare, a diverse team of oftenly highly specialized healthcare professionals, that is cooperation. So when you're talking about cooperation in healthcare, people are cooperating are not just common people, but highly specialized professionals. There. So the cooperation that gets to happen in healthcare is from highly specialized. Each person has got their job description. They have got their own profession that they have to do. But even if they've got different profession, they come together for a common good. Okay. So in here, we need to understand multi-professional teamwork. When we are talking about multi-professional teamwork, just from multi we can see that this has to do with a lot of professions coming together to do something common. Whenever we say team, this has to do with people coming together for a common good. So multi-professional teamwork. This is a cooperation that is defined as complementary relationship among organizations and occupations in healthcare, including integration, networking, coordination, resulting in the joint production of goods and services. So when health professionals get to come together, health professionals gets to come together. Now, it is a complementary relationship. There is a relationship among health professionals. This relationship is complementary, where each person has to do something. There is something that they are responsible for. And so, it has to do with the coming together, networking, or the coordination, joining together, that is resulting in joint production. So the aim is to make sure that there is a joint production of what? Goods and services. Doctors, nurses, pharmacists, physiotherapists, psychologists, they come together just to make sure that there is joint production of goods and services. So they get to establish that relationship. So that can be done in so many ways, where just people get to come together, networking, integration, coordination, just to make sure that something has to be done, people get to work together. Now these are not just mere people, but mm, professionals. So that is multiple professional teamwork. So as this gets to happen, there are some things that we need to understand about multiple professional teamwork. The first thing that gets to happen here is there is need for a definition. So we need to define the collaborative approach as you get to work together. So what approach are you going to use to make sure that you come jointly together for the production of a common good and a common goal? So what approach are you going to use? So that approach is going to be defined. After the approach is defined, you are going to respect the role to team members. So each member of a team has got their own role, and it is very, very important to respect the role of each member of a team. So if this one is supposed to do this, let them do what they're supposed to do, and also do what you're supposed to do respectively. So there's need for respect for the role of each member of the team, and also there's need for assigning. So assign specific responsibilities. So this is one also important thing when there is need for multiple professional teamwork. The assignment of specific responsibilities. This one comes, okay, you are going to do this. This one is going to do this. Of course, you need to respect the role that each one is going to be playing as you get to give each other specific responsibilities. So you are going to be looking at making sure the environment is clean. You make sure that medicine is always delivered. You make sure that surgeries are always done well. So everything like this, a person is going to be given a specific responsibility to do, and to be able to work just with respect, and also making sure that, of course, you need to fulfill, because remember we're talking about a what, a team. A team goes for a response, something that is in common to everyone else. So if one person fails, the rest of them is going to fail. So after then, when you define the collaborative approach, you respect each other's role. You assign specific responsibilities. What is going to remain is now you get to practice collaboration. So now do it. So now get to practice collaboration. Of course, as you come together, because this is a group, there can be conflicts. You need to also make sure that you have conflict resolution mechanisms. So if there's a conflict, make sure that you get to resolve it, and also work towards improvement. So that is on the practice. So the first thing, as you get to look at multi-professional teamwork, define the collaborative approach, respect the role of each member, assign specific responsibilities, and make sure now you start to practice collaboration. And in practicing, make sure that you get to also practice some of the conflict resolution methods, because there can be conflict that can be arising because of gathering always that gets to happen. So now let's look at the health professions team. So when we're talking about a health professions team, it involves all team members that they are all essential in providing exceptional care. So that is a health professions team. Okay. Now, a health professions team includes a lot of people with different job titles. Now, the first ones we talk about, we have got nurses. They are part of the health professions team. Apart from the nurses, we have got pharmacists. We have got also health laboratory and biomedical scientists. Apart from those, we also have imaging staff. Now, each of these have got their own responsibility to do, and we are going to look at those responsibilities that each one of them is supposed to do. Apart from that, we have got physiotherapists. And then we have got public and health and community health staff. And then the seventh, we also have administrators. And then the last ones, on this list we are going to put, that is the eighth ones, we have got policymakers. Now let's look at the role of each one of these. What is their importance? What do they do in making sure that there is proper health delivery? So when we get to look at nurses, nurses get to provide clinical and community care. So nurses are very, very important for the care that they get to provide at clinical and community settings. So that is why it is very important for nurses to be those people with a kind of warmth, just a courtesy, just having empathy, getting to think for people, putting themselves in the shoes of others, because these are the ones who get to associate even more, caring for the patients. So that is their work. So they come together for a common good. There is also pharmacists. Now we need to know medicine is an important part of healthcare. Pharmacists are there to make sure that they deliver this medicine. So that is their role in health professions team. We also have laboratory and biomedical students. So these get specimens and process the specimens in the lab. So for example, we've gotten blood. You want to see something on this patient. So you get to take to the laboratory and biomedical scientists. They are going to work on those samples and get to process it in the lab. We also have the imaging staff. These get to work on looking deeper in the body by using things like x-rays. So imaging of the body forms an important part of patient's investigation. So when you want to investigate about the patient, maybe there's a fractured bone, you want to check in their body, you need to go to the imaging staff. They perform their work. So apart from that, we have got physiotherapy. So physical therapy is required for treatment and also preventive care. There are some things that you need to just do physically to avoid diseases. So that is why physiotherapists are there. They're going to advise you. Yours is to make sure that you get to do a lot of exercises, stop eating some of these things just physically. There's no need of medicine there. So those are there also for their job. Very important. Also, there is the public and community health staff. So disease prevention is an important component of healthcare, and the public or community health staff get to go out there in the communities to make sure that they sensitize the community, and they tell the community to know that there are some diseases which are spreading. So you need to do this to make sure that you stay away. So apart from those, there are also administrators. So administrators get to implement health policies and provide oversight of health professions and a necessary part of healthcare team. The administrators, these are the ones now which get to make sure that health policies are seen. Okay, they are an oversight, they are there to implement. So if we've said you should be coming at 8 hours, make sure that you are 8 hours at work. They are there to implement that. If you do not come at that time, well, you are going to suffer the consequences. So that's the work of the administrators. There are also policymakers. Now policymakers provide direction on how health services are going to be delivered. So policymakers will provide directions. How should you deliver health services? And then the administrators are going to be able to implement those policies which have been made by the policymakers. So that was it for this tutorial. Hope that was helpful. Make sure you get to subscribe and get to share with others. And make sure you do a lot of practice questions by checking through the tutorial sheets, and also just make sure that after the class you get to ask yourself some questions and see if you are able to answer. Well, thank you so much for watching and stay blessed.